province has expanded the number of conditions that pharmacists are now allowed to give prescriptions for. 6 more ailments have been added to the list.
These 6 common ailments are in addition to the 13 pharmacies have had the ability to provide treatment for since our government announced changes in January of this year. Over 89% of pharmacists across Ontario are participating in this program, and over 400,000 assessments have been made since the start of the year.
The minister says patients just need their health card in order to access pharmacists' treatment. She says the move is part of the government's plan to make healthcare more accessible for everyone. And earlier, we asked infectious diseases specialist Dr. Isaac Bogoch what he thinks of the expansion.
This is a very smart approach, and this certainly lowers barriers to accessing healthcare. We know pharmacists are a major pillar of our healthcare system, and we know pharmacies are, virtually on every corner, represented in every community. By enabling pharmacists to provide some relatively straightforward and very common remedies to these ailments, I think will take a lot of pressure off of family physician visits, emergency room visits, urgent care visits, and it's going to do a lot of good. Here's the thing, though. This cannot come at the expense of investing in primary care. We have a family medicine crisis in Canada. We don't have enough family physicians, and certainly every Canadian needs a family physician. While this is certainly an extremely important step in enabling people to access healthcare, we still need to have significant investments in family medicine in Canada to ensure that everyone has access to a family physician, because that's preventative care, longitudinal care. It's extremely important to do. So this is a good step, but there's a lot more we need to do as well.
Any concerns, Dr. Bogoch, about now just transferring the pressure, as you said, from the family physician or from a hospital now to your local pharmacy and having long lineups there and people just sort of waiting and waiting to see their local pharmacist?
I don't think so. I really don't think so. I think there are so many pharmacies and pharmacists that are participating in this, and I think this will be very welcome. I think it's extremely challenging for many people to see their family physician. There might be long wait times. Many people don't even have a family physician and will have to go to a walk-in clinic or an urgent care clinic or an emergency department where there'll be long wait times. And this just diffuses a lot of the pressure on the healthcare system. These are relatively straightforward and extremely common ailments, and the treatment of them is also extremely common. There's no reason people should be waiting in an emergency department for any of these issues, or waiting in a walk-in clinic or an urgent care clinic for this. This can be dealt with in a pharmacy. But again, there's the longitudinal care that's extremely important, and it's extremely important that everyone has access to a family physician. And again, we need to see a significant investment in that to provide holistic longitudinal care for individuals and families.
Justin Bates is the CEO of the Ontario Pharmacists Association. He joins us now from Barrie, Ontario, for further thought on this topic. So, Mr. Bates, thank you so much for making time for us.
My pleasure.
Let's walk through this experience, because I'm looking at the full list of everything that an Ontario pharmacist is permitted to assess and give medications for, everything from acne to diaper rash to tick bites to urinary tract infections. It's a lengthy list. If someone walks into a pharmacy now in Ontario and they've never gone through this process before, walk us through what they need to do and what the entire procedure would be like.
Yeah, it'll be very similar to how you would go about this in other parts of the healthcare system. There is one wrinkle to it in the fact that we do have that on-demand walk-in type of service because of our high accessibility and the footprint of over 5,000 community pharmacies that are open late and some even 24 hours. But the vast majority of these ailments will be assessed and treated through an appointment-based model. So either using an online scheduler that most pharmacies have, or by calling the pharmacy to schedule an appointment, and you would have the assessment done in a private area of the pharmacy, and the pharmacist would walk through the history and confirm the self-diagnosis in this case, and then determine the most appropriate treatment path, which may be an over-the-counter medication, could be a prescription, or it could be a referral to another part of the healthcare system.
Will there be a charge for this assessment?
Well, the good news is that this is a free service, if you will, for Ontarian residents. In other words, the government's OHIP program is picking it up, so you will not have to pay out of pocket.
There is some concern that could a pharmacist, because it's on demand and it's immediate and they're rushed because there's so many other things to do, could they potentially misdiagnose or miss something in general?
Absolutely not. And in fact, we're very confident that there is zero risk to public and health of patients, in part because we've been doing this for a long time. Even in Ontario, this program was launched in January 1st, and there is no evidence after 400,000 plus assessments that there's any risk of misdiagnosis or healthcare challenges that wouldn't exist in any other part of the system. Also, this is not new across the country. Ontario is late to the game when it comes to expanding this type of scope of practice. It's been in place for well in excess of a decade in many of the other provinces. So there's a large data set to suggest that this can be done safely and effectively, and within the training and education and expertise of the pharmacy professionals.
So earlier in the day, we spoke with Dr. Isaac Bogoch, who's an infectious disease specialist. He's someone we often turn to, and we got his perspective on this, and he gave this a huge thumbs up, saying this is so great. You know, the pharmacists are easily accessible, and it would in some ways relieve the burden on an overtaxed, overwhelmed healthcare system. Not to take money away from it in any way, it still needs additional funding, but that this would help. Some of us are concerned that it's going to just end up putting more pressure on the front lines at the pharmacies, and we're going to see long lines there and potentially a lot of burden placed on these individuals.
Yeah, that's a fair observation. I think we're always concerned about the health human resources burnout across the healthcare system. This is intended to create capacity and help divert emergency department visits and potentially hospitalizations, as well as address some of the gaps in primary care with the shortage of family physicians. That said, we have operationalized this both when you look at how we were able to quickly mobilize for the vaccine program in COVID, in addition to testing and prescribing for Paxlovid. So we've learned a lot about how to optimally do this and to appropriately staff the pharmacies with pharmacy technicians who are regulated to do many of the dispensing related activities, as well as take on these additional tasks with pharmacists who are ready to step up. And we have 89% of the pharmacies that have provided at least one assessment since January. And the demand has been quite high, and there hasn't been an added workload, if you will, in terms of lineups and things like that. So I'm very confident that as we go through this phased approach and continue to add ailments to the program, that we can do that in a fashion that both is efficient and safe for the public.
Are you hearing any concerns from pharmacists?
I think there's, the usual concerns you have across the healthcare system, making sure that we support with the right tools and that, the preparations are all put in place. But keep in mind that pharmacists have been training for this with their, 6 years of advanced education, similar to other healthcare providers. And this is an exciting time for the profession because now they can practice to what they've learned and educated through their PharmD programs across schools of pharmacy in the country. So most pharmacists, if not all, are very excited and continue to want to step up and provide solutions to help create more access for Ontario residents.
Mr. Bates, while I have you, I want to ask you about a different kind of expansion. So this week we heard that Shoppers Drug Mart is opening up a couple of these pharmacy care clinics. So it's essentially a pharmacy, but it's also, in a way, a medical clinic. There's a waiting room area. There's a place where you need to get assessed. There's a reception desk specifically just for these health-related activities. So what is your take on these new types of clinics that are opening up?
I think it's fantastic, and it really signals the transformation into this service type model. And you see it in other parts of the country. Nova Scotia has launched pilots for these pharmacy clinics to help address some of the gaps in primary care and public health, whether it's through immunizations, point of care testing for acute and chronic conditions, or things like prescribing authority for common ailments that we're seeing in Ontario. It's really meant to create that healthcare space with the behavior that we understand of what people expect when they go in, to be able to have that waiting area, to have that private counseling area. So while it's not new in terms of what we've seen in other pharmacies across the country, with Ontario's expansion of scope of practice, this is an important step to continue to make sure that the environment that patients go into is conducive to receiving these types of services, which complement the existing services around dispensing of medications.